Okay, hello guys. So today we're going to be talking about something really important. So we have the thorax and lung assessment. So now this might seem a routine, but it's actually a critical part of understanding a patient's overall health. So, but our lungs play a huge role in keeping every part of the body functioning. So, importante talaga yung lungs natin. So, and small changes in breathing or chest sounds can tell us a lot. So by assessing the thorax and the lungs, we can pick up early signs of conditions like asthma, pneumonia, or even heart failure. But sometimes before the patient even notices symptoms, it is not just about listening to breath sounds. So but it's about putting the whole picture together to guide care. So whether you're in a clinic, a hospital, or out in the community, having a solid assessment skills or knowledge can really make a difference. So, like catching problems early on and helping patients breathe easier, literally. Okay? Okay, good morning, sir.
Good morning.
So, my name is Abdulkarim Mohnna, and I am a registered respiratory therapist. So, I'm the one who will be performing the lungs and thorax assessment. So, before I begin, may I ask your full name?
Sure. My name is Mark Efros Kadir Itayo.
Okay, so thank you, sir. And what may I address you? What do you prefer? Should I call you?
Efros.
Efraz, okay, Sir Efraz. So thank you. Today I'll be conducting a physical assessment and for your lungs and thorax. So this is a routine procedure, meaning I'll be checking your breathing sounds, your lung sounds, and overall respiratory health. Okay?
Okay.
So it helps us to identify any problems, issues early. Okay. So I'll be asking you a few questions. Okay, sir? Is that okay with you?
Yeah, that's okay.
Okay, I'll be asking questions about your health, your lifestyle, and I may need you to change position slightly to diagnose and do my thing. So when I listen to your lungs, your cooperation will help me. Okay, sir?
Okay, sir.
So do you have any question before we begin?
No, no question.
No? Okay. So before I start, I'll be doing a hand sanitizing. Okay, so before we start diagnosing the patient or assessing him physically, we have to sanitize because it is important for us to disinfect any residues from the hospital. We don't know any bacteria that might have stick to us, so we have to sanitize. We have to do a proper sanitizing. Okay. I will be providing you a privacy, so you can change into your gown, sir. If is that okay with you? I'll give you your own space. Okay. I'll make sure your privacy is respected. Don't worry. So please let me know if you are uncomfortable. Okay. So now I'll begin to assess your lungs and your thorax. So I'll be inspecting, I'll be palpating, percussing, and auscultating different areas of your chest and your back. So I'll let you know what I'm doing each step. Is that okay with you?
Yeah, it's okay, sir.
Okay, sir. So hindi muna natin papalisin yung damit sa pasyente natin kasi for demonstration purposes only. Tsaka ayaw nito. Okay, so today we will be inspecting the posterior and lateral view, and we will be comparing the anteroposterior and the transverse diameter. So we will inspect the the spine for any deformities. Okay, so far parang wala naman. So sir, can you please inhale, exhale? Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. So there were no any notable deformities or irregularities in the patient's breathing and the shape of the spine. So everything is normal so far. Now I will be palpating the fremitus using the ulnar part of my hand. So we'll be diagnosing if there are any consolidations or any irregularities. So sir, can you say 99?
99.
Okay, say 99, sir. Okay, say 99. Say 99. Okay, say 99. Okay. So far I didn't note any the vibrations were there and everything was normal. So now I'll be inspecting the patient's chest expansion. So specifically on the T9 or T10. So we have to observe any unequal chest expansion. Okay? Okay, here, T9. Sir, can you please inhale? Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, so everything seems to be normal. The chest expansion is symmetrical and there were no any irregularities. Okay, so now we have to percast the patient's back. Okay, sir, can you come closer? Here. Okay. Okay, so far I've observed the flatness and the dullness of the patient's lungs and everything seems to be normal. and I didn't observe any hyperresonance. So using our stethoscope, we will be listening for any abnormal breath sounds. Can you please inhale and exhale, sir? Inhale, exhale, please. Inhale, exhale. 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 Okay, I didn't notice any abnormal breath sounds and everything seems to be okay. So now we will be doing the procedure called bronchophony. So we will be observing for any consolidation like atelectasis or pneumonia. Sir, as soon as my stethoscope hit your back, can you please say the word 99? Okay, 1, 2, 3, can you say the word 99? Okay, there were no consolidations, everything seemed to be okay. So now we'll be doing the procedure called egophony. So we will observe if any of the words he says from letter E, if it shifts to letter A. Okay, sir, same procedure, but say the word E, okay? As soon as my stethoscope hits your back. Okay?
E. 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 E.
Okay, there were no any notable sounds that shifted to A, but everything seems to be okay, normal. Now we'll be doing the procedure called whispered ventriloquy. So we will be letting the patient say the word 1, 2, 3. Okay, sir, same procedure, but now it is 1, 2, 3. Okay, sir.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, so everything seemed to be normal and everything is good. So lung and thorax assessment is unremarkable. So chest is symmetrical with no deformities and no use of accessory muscles noted. So everything's okay talaga. So breath sounds are clear and equal bilaterally with no wheezes or crackles or rhonchi, and there were no signs of respiratory distress. So fortunately, the patient is okay and there were no any notable irregularities.